Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome to this episode of Family Practice. I'm Dr. Jeff Fox. Tonight, Baptist Health has a new location in Hamburg. We're going to introduce you to the CEO of Family Practice Associates. And do you have allergies? Are your nose running, your eyes itching? We're going to tell you how to fix that. And Sayre Christian Village is here. Tonight, to start us off, my first guest is Mr. Chris Rohde, who is the president of Baptist Health Lexington, both on Nicholasville Road, and you got a great big new incredible location in Hamburg.
We do. We're really excited. It's been years in the making. We purchased that land in 2009, and here we are in 2024 when it's finally opened, and we're really excited. We opened for business yesterday.
So really excited. Tell us some of the things that's there and what we can look for.
So there is a freestanding emergency department. There is a outpatient cancer center, ambulatory surgery center, and a medical office building. And of course what goes with that is imaging and lab and retail pharmacy, those types of things as well.
Now you talked about like imaging. You've got MRI, you got CAT scan, you got PET scan,
yes.
Got x-ray, got it
Yeah,
all.
all of that, yes.
And so, how long is that going to be available? Is that going to be up and running 9 to 5, 7 days a week?
Well, so with the freestanding ER, we'll have the MRI and the CT scanners. They're going to be going around the clock. But some of the breast imaging, such as those things, that'll be more 9 to 5, if you will.
So they can also get mammogram.
Mm-hmm. Yes, they can.
Women's Health can get their mammogram
Absolutely.
out there. I also saw something about retail pharmacy. Is that out there, going to be out
It
there?
is. It's out there. So you can go and get your scripts filled and you pick them up.
Now, it was a big weekend, and I attended some of the events, the ribbon cutting, the dedication. They were well done and just real nice. Tell us a little bit about maybe the history, how we got there, and then what's happened over the last couple of days.
Yeah.
People really coming out.
Yeah, so a little bit of history. We purchased the land in 2009, and I tell you, all the thanks goes to my predecessor, Bill Sisson. That was his vision, that was his passion, and he got the ball rolling, and I have to say we're just humbled to carry it forward. But the ground was broken in around 2019 or 20, and I came in 2021, and we just carried forward that vision and opened yesterday. But that's kind of the history as far as that goes.
Now you're going to have a surgery center,
Yes.
outpatient emergency room, and a lot of outpatient stuff. It's not really an inpatient facility right now.
Correct. So all outpatient right now. Our next phase 2, will be an inpatient tower. And we've got a certificate of need. That's something we have to have in order to build inpatient beds. That granted us 60 beds. So,
okay. So what do you think the future is? Is that going to be a big hospital?
It will be. You know, down the road it'll be a full big hospital, if you will. It's going to take some time to get there. We will not duplicate every service we have at Baptist Lexington on Nicholasville Road and do the same out there. We'll have to be more strategic as to what we choose to put out there.
Now, your service area, it's a great location. We've got 64 and 75. So the people who are watching here, we're not only servicing Fayette County, we're servicing a lot of Kentucky.
So this is, a great day where we can, it's not only central Kentucky, but eastern Kentucky. It makes it much more accessible to them.
And easier to get to.
Much easier.
Now, you mentioned Cancer Center. Is that open now, or is that something coming along?
So the Cancer Center will open up in June. So we'll have infusion therapy, so patients that need chemotherapy can go there, but we'll also have a linear accelerator that will do radiation therapy.
So you can basically do it all.
Yes.
Cardiology is going to be a big thing out there too in terms of diagnosis.
So yeah, we have a non-invasive lab right now where you can have a stress test, stress echo, all those types of things. And then we have the cardiology clinic there where the physicians see the patients.
And with all this extra services, the volume we've been dealing with is going to allow scheduling to be a lot easier and a lot more convenient for everybody.
It sure is. It opens up a whole new access point for central and eastern Kentucky.
We appreciate what you do for the community of Lexington. We look forward to seeing. It's a big, nice facility, so if you haven't got the opportunity, you ought to go out there. We thank you for coming in and tell us about it.
Thank you, Jeff.
Appreciate it.
All right.
We'll be right back.